big developments today on the healthcare front. According to a new government report, the number of companies and unions getting healthcare waivers has doubled in just the last month. In other words, sort of a waiver to get out of complying with a portion of the healthcare law. So why exactly do unions and these big companies say they need these waivers, and why shouldn't they be forced to play by the rules that everybody else will be forced to? Syndicated radio talk show host Leslie Marshall is a Fox News contributor, and syndicated radio host Lars Larson is with me as well. All right, panel. So there's a criticism now that the number of waivers is going up, up, up. That it was down in the hundreds and now it's up to 222, and that the Obama administration, Lars, has been quietly granting waiver after waiver to these employers. It started with McDonald's, now it's Waffle House, now it's Universal, and now it's unions, several smaller unions and larger unions who are getting waivers not to comply with the healthcare law. And what does that tell us about the healthcare law, Lars?
It proves that the plan was unworkable. Obamacare is unworkable because the idea was that everyone had to be covered, everybody had to be in the system. And I'd take you back to September when the Wall Street Journal had a story about McDonald's. The week before they were granted the waiver, McDonald's Corporation quietly floated the trial balloon that they were about to drop 30,000 workers, low-income workers, from their health care plan altogether, because the mini-med plans that they have would be destroyed by the Obamacare system's mandates. So a week after they dropped that, or they floated that trial balloon, all of a sudden the federal government says, you know what, we can let you out of that requirement. Since then, the number went to 222. In the last 3 weeks, the number has doubled. And if you look at the list, Jack in the Box, Denny's, an awful lot of assisted living homes, old folks' homes, those are the kinds of places that employ low-wage workers who are covered by these mini-med plans that are going to be decimated by the Obamacare health system. But
Leslie, they say, look, it's only these mini-med plans, meaning if you work at McDonald's, that you get some coverage, but it's not like the greatest coverage. It doesn't cover a lot. And McDonald's says we can't comply, and these other companies say we can't comply with the new law because it says we're not allowed to have any caps on how much we pay out over the lifetime of the policy. And that's not going to work when you employ as many people as we do, and you're only giving them the sort of the mini-med as opposed to the Rolls-Royce med.
Yeah, that's accurate. And many of those companies that Lars mentioned, the Jack in the Box, the Denny's, McDonald's, have a lot of part-time workforce. And some of those workers are getting a mini-med plan because they're not full-time employees. So in a sense, they're not only not contributing to, but they're not working the hours that would pay into, even with the labor, into a full-time employee's benefit plan. Thus the mini-meds and thus the waivers. Because mini-meds, I would agree with Lars that in the sense that the plan didn't consider the part-time employees, and that was one of the criticisms I had when the plan was rushed through, that they weren't looking at mini-meds and part-time employees.
Go ahead, Lars.
But remember, Megan, there's another effect, and that is, while it's decimating to mini-med plans, it does the same thing at a smaller scale to everybody's health plan, even to your health plan.
How so?
Fox News is going to have to pay more money because there are more mandates. Obamacare said, let's add the bells and whistles to every health care plan in America and force employers to provide that. When they do that, the cost that your company has to pay to cover you, Megan, is going to go up. The company has to find that money somewhere. Now, I know Obama's idea is, well, just go out and charge all your advertisers more money for fewer commercials. Unfortunately, in this economy, that doesn't work. So it's going to have the same effect that now companies are going to have to say to somebody like you, Megan, I'm sorry, but your deductibles are going to go up. Or other things are going to go up. You're going to have to pay a greater percentage. It's going to hurt every single American employer.
We are already seeing some companies say deductibles are going up and premiums are going up. Leslie, I've got 20 seconds for you to respond.
Actually, deductibles, co-pays, and premiums went up for 3 years with Blue Cross, and I know this personally and as an owner of 2 businesses. So that is not because of health care reform. And if we had a public option and put competition into the private sector, they'd be forced to reduce those premiums, co-pays, deductibles.
All right. Well, that's a good debate. Tease it up interestingly. In any event, both unions, many of these are local union health care funds, in addition to companies getting these waivers. More on that as we get it. Leslie, Lars, good debate as always. We appreciate it.